So,
Who are you?
oh, some guy, you know.
Yeah, right. What's your birthday? Yeah.
So, one of the reasons I do these talks, and I go over this a lot, is I do talks on Tuesday night because I want to make my patients more intelligent about the healthcare choices they make. I see so many people that make bad choices with healthcare and they end up paying for it in lots of different ways. So I want to educate you on how to think about your body differently, how to make choices better. I also want to help you look at health more than just the elimination of pain, but actually becoming healthy, okay? So tonight, we're going to talk about the non-therapy of many medical therapies. Now, this isn't a diatribe against physicians, because I have some physicians that are friends of mine that I like, okay? But I like to go back into the 80s and do a little history and go forward to where why I developed this talk. So does anybody, if you go back to the 80s, what was promoted in the 80s, some of you guys remember this, that turned out to be an absolute boondoggle? It was something that was really promoted as the thing. I'll just give you a hint. It had to do with nutrition. Had to do with nutrition.
Anything to do with eggs?
What?
Anything to do with eggs?
Well, that could be part of it. But it's not what I'm thinking about. It's a little bit bigger than that, Dana.
Okay.
It was the low-fat diet.
Oh, that's right.
The low-fat diet. Nobody ever did any research on that. There was not one piece of research that validated the low-fat diet. They just thought, hey, if you eat fat, it must make you fat. Well, as a matter of fact, that doesn't happen. And the low-fat diet actually made people fat and it made people diabetic. And so that's when I realized that when I read Barry Sears' book, The Zone, in about 1992. And so I realized that he just decimated the low-fat diet. He's a PhD in biochemistry, and I got to meet him at one time. And so then in the 90s, what happened in the 90s? What was approved in the 90s that turned out to be an absolute disaster in the 2000s?
Give us a hint.
It was a painkiller.
Painkiller?
Painkillers.
Opiates?
Opioid drugs.
Opiates.
So there's a small study
Poppy.
in 1986 done by a pain specialist by the name of Russell Portnoy. He was 31 years old, practiced in New York City. He published this study about how opioids aren't a problem. And the FDA looked at that study, and instead of doing their own study, they approved opioids based on a very small study. They made government policy, a huge government policy, based on a small study. What happened? What happened in the 2000s?
Made addicts out of a lot of people.
Yeah, hundreds of thousands of people died, actually, because the FDA didn't do their job, okay? And the CDC, I could lump them in with that too. So here we have the FDA co-opted with the Sackler family and Purdue Pharma, which were they were pushing the opioids like crazy. And we had the opioid problem. Now we have COVID, and I'm very, very skeptical of what I hear coming out about COVID, simply because of what I see done in the past. With the low-fat diet and the opioids, why should I believe about COVID?
And eggs being bad, yeah.
Eggs being bad, all of that, And so what I want to talk about today is I want to talk about some of the things that are done commonly in medicine that have no scientific backing behind them. So you guys, if you're ever in a situation where you have to choose some of this, you can think intelligently about it. So there are several things that medicine does extremely well, and I'll give them their credit. They do crisis intervention therapy. I mean, you're ever, in war and shot up, you're ever in a bad car accident, man, that is where they shine. These guys are good at They're good at reconstructive surgery. So you have a hip, bone on bone, they can give you a new hip. Now here's a problem. They can't teach you how to keep your hip from being replaced, but they can give you a new hip. If you have cataracts, they can do the surgery on the cataracts, give you eyesight, but they can't tell you how not to get cataracts.
Yeah.
If you have a knee problem, bone on bone, they give you a new knee. They can really improve the quality of your life, but they cannot tell you how not to have knee replacement. Okay, here's the problem I have with medicine, is that medicine can do a lot of things to improve your quality of life. There's one thing they cannot do, they've never been able to do, they never will be able to do. What is it? Anybody? They can't make you healthy. They cannot take an unhealthy person and make them healthy. They can improve the quality of their life. They can give you drugs. They can do procedures. They cannot make a person healthy. So they can treat tropical.
What they're doing is, would it be fair to say they're just treating symptoms?
Most of the time. Yeah, most of the time that's what they're doing. Right. They do pretty good with third world diseases. I mean, you got all these parasites. Now I have supplements. I have nutritional formulas that'll take care of parasites, but their drugs will too. I mean, they're pretty good with this. So they do some things that I think are really good. However, there's some things that are not good. So one of those is back surgery for chronic back pain, aspirin for the prevention of cardiovascular disease, and arthroscopic surgery for knee pain. These are three things we're going to start off first. So this first one comes out of a journal called Pain Medicine. Very, very well-respected journal, September of 2018. 2 years ago, okay? Surgery for lower back pain is considered the standard of care in medicine, okay? Many of these invasive procedures are marketed and paid for without clinical trials demonstrating evidence of the effectiveness. Because of the bias towards surgery, patients are getting a false impression of the true efficacy of these surgical procedures. It's right out of that journal, Pain Medicine. Now, let's look at surgery of osteoarthritis of the knee. Studies of real surgery versus sham surgery for knee pain demonstrated similar findings to this study they did on low back surgery. So what is sham surgery, by the way? Anybody know? It's where they make a slice, they'll cut it, they'll just cut the skin, and they'll sew it up. They won't do anything other than that. It's sham surgery.
Fake surgery.
So if they do sham surgery on their back, cut the skin, they sew it up, they don't do anything else. Okay? So sham surgery versus real surgery. Sham surgery is more effective than real surgery, and there's no difference in outcomes after 6 months. Okay? What were the results of a study that looked at real back surgery versus sham surgery? So in studies that investigated sham surgery versus real surgery, the proportion of improvement due to sham treatment was 73%. The improvement in the sham surgery group was greater than after real surgery. The pain reduction in the sham groups accounted for 87% of the improvement seen with active treatment. The real surgery group showed no difference in pain at 6 months compared with the sham procedures. Okay, so if you go in for lower back surgery, you might want to ask him for the sham treatment. Yeah. Okay, yeah. You might be better off. Okay. This article stated the following. Again, same article, Pain Medicine. The risks of surgery include anesthesia, permanent injury to the body, psychological stress, time cost, money cost, and productivity loss. Large numbers of patients are exposed to risky and possible unnecessary procedures. The current evidence does not support invasive procedures for treatment of chronic pain. Now, I have a friend who works at a big orthopedic group here in Lincoln. I've talked to her extensively, and she says she sees patients come back after failed surgery, after failed surgery, after failed surgery. And she says, I see people coming back for their third back surgery hoping that it's going to fix them. She told me that she sees a lot of that, and you know what I'm talking about. Okay, so What about daily aspirin for all-cause mortality? Now, how many of you ever was taking aspirin every day? Okay.
I used to.
Yeah.
I
Okay.
used to too.
Yeah.
For
So
diabetes, yeah.
this is what is the effect of daily aspirin and all-cause mortality in the elderly. This comes out of the New England Journal of Medicine, 2018. Okay. So this was a large study which recruited 19,000 people over the age of 70. The trial wanted to investigate whether daily use of baby aspirin would prolong the lifespan of older adults, because isn't that ultimately the goal, is quality of life or length of life, right? Okay? So the daily use of aspirin did not provide any benefit. That's one of the things they found in that study. Subjects taking aspirin had an actual higher death rate than people taking the placebo. Cancer was the main contributor, especially GI cancer. Aspirin has been shown to influence various cellular and molecular pathways that are relevant to the spread and initiation of cancer. Okay, so there's this connection between taking aspirin and getting cancer. How many of you knew that? You should know that, okay?
Yeah.
But you won't know that because you won't
They
hear it
won't tell you.
in the media. You will not hear it, okay? A May 19, 2019 study from the Journal of American Medical Association, you can't get more blue blood than that when it comes to medical journals, said patients taking low-dose aspirin for the prevention of cardiovascular disease showed the following. An increase of intracranial bleeding by 37%. Okay, that's bleeding in the brain. Okay, not good. Okay, an increase of intracerebral hemorrhage by 52%.
That's worse.
Okay, again, you don't want that. All right, so that was in Journal of American Medical
What's the
Association.
difference between intracranial, intercerebral?
Intercerebral?
Cerebral.
Yeah.
Intracranial
Is it intro
outside
with
the
this?
brain?
Intracerebral is in the brain. Intracranial is more in the meninges of the spinal cord, the covering of it. What about cholesterol-lowering drugs?
Oh, geez.
How many of you know people that take statins?
I used to.
We all
used
know
to too,
people
yeah.
that take statins.
Don't
Okay.
take them.
Okay. Yeah.
I like
Which
what
was
you're
what it
doing.
was.
I don't know
So-
what that is.
It was a fad.
What does the medical literature have to say about taking statin drugs? So we're going to look here.
It's supposed to lower your cholesterol or your
Causes liver
HDL.
damage, huh?
It actually causes 6 more problems with other organs of the body, and then you can't enjoy grapefruit. And I'm a big grapefruit eater.
That's right. big time.
Yeah.
Juice or the
On
grapefruit
Lipitor, you can't
every
take
day.
grapefruit.
You
Yeah.
can't.
So
No, not on Lipitor. It
it does
interferes with
lower
it,
cholesterol
actually.
pretty well. The statins lower it really well.
But if you
The
lose weight, it helps.
The problem is, yeah, that's right.
If you lose weight, you
Statins
don't
do not
have to
work
take
for the
Lipitor.
primary prevention of coronary heart disease.
Mhm.
Don't work. Okay? So, in almost 80% of the total number of individuals, LDL cholesterol was inversely associated with all-cause mortality and with statistical significance. That means the higher your LDL went, which is what they're trying to lower, the more the longer your lifespan and the less morbidity that you'd have. So they're saying here, LDL cholesterol is actually pretty good. Okay, in this article, which comes out of the British Medical Journal, 2016. Okay, what do statin drugs do? So what are the side effects of statin drugs?
Feel like crap. I
Yeah.
did. I felt terrible.
Oh yeah, a lot of people do.
Yeah, it affects your heart, affects your liver,
I didn't take it for more
it
than a month,
affects
and
your
I just
blood,
wouldn't take them.
Affects your
Affects
muscles, a lot of
muscles,
things.
bone.
So it can actually
devastating.
increase your risk of diabetes. Okay,
Uh-huh.
increase your risk of myopathy, which is muscle weakness. Okay, how many of you want your muscles to get weak?
Uh-uh.
Yeah, I don't.
Uh-uh.
I want them to get stronger.
I want to do push-ups, yeah.
Cause increased risk of intracerebral hemorrhage, cause increased risk of lung disease, cause increased risk of Parkinson's disease, increased risk of cancer, increased risk of cataracts, increased risk of arterial calcification.
Mm.
Okay, now this is a quote from the article, right up from the article. All such major adverse clinical events had been reported so frequently that it prompts authorities to warn of such devastating complications in otherwise normal, healthy individuals. But even when aware of these complications, there's been hesitations in putting statins off the market.
I agree.
So I can tell you this, I will never take a statin drug, ever. We'll never, I mean, I don't want to take any pharmaceuticals, but I'm not going to do this, that's for sure. Too many issues. What about Premarin? Premarin,
That's where it comes from.
yeah, is an estrogen replacement for women experiencing menopause. Okay? How many of you here have ever heard of Premarin?
Oh, golly, yeah.
Oh, Premarin was big thing in the 90s and early 2000s.
Yeah.
For women,
Yeah, for
Yeah.
women, estrogen replacement.
Yep.
You get it from, they get it from the urine of pregnant horses. That's where they get the name for it. Premarin, pregnant mare urine.
Horse, yeah.
That's where they got that name. Okay, they believed it.
It's awful.
Understanding they believed it. There's no evidence to back this up that it prevented osteoporosis,
Oh, man.
improved cholesterol, and reduced cardiovascular risk. No properly designed studies to suggest such benefits. Premarin was the most widely prescribed pharmaceutical in the world for years. Okay, a high quality study in 2002 showed Premarin increased the risk of heart attacks, stroke, blood clots, breast cancer. Now, let me tell you, and it says the endometrial cancer. I want to say this about any kind of estrogen replacement therapy, especially in postmenopausal women, even bioidentical estrogen replacement therapy. If you take a postmenopausal woman, you give them bioidentical estrogen replacement therapy, that is cancer waiting to happen. You don't do that. Okay, there's other ways to get their bodies to produce estrogen and progesterone rather than giving it to them. That is cancer waiting to happen. Okay? The effects of these non-human estrogens when administered to humans were not fully understood at the time, and they really still don't understand all the things that they do. I mean, they're putting horse estrogen in people.
Yeah.
You know, I bet it would be against the law to put human estrogen in horses, you know.
Yeah.
I'd probably be called animal cruelty. I don't know, but yeah. There are no studies demonstrating the superiority of these estrogens over human estrogen. Let's look at adverse drug effects, just in general, the side effects of prescription drugs. Adverse drug events are associated with an increased rates of disability, hospitalization, and mortality, and may result from appropriate use of medications as well as overuse and misuse. If you're older, and I don't know if elderly here is over 70, over 65, there's a median prevalence rate for adverse drug events of 12.8% overall. So about 13% of the population that takes pharmaceuticals experience adverse effects. About 16% of elderly patients experience it. Mortality rates due to adverse drug events are escalating. Analgesics, which are painkillers, aspirin, opioids, Tylenol, acetaminophen, are among the drug classes most often associated with adverse drug events, which is why I try to convince people, get your pain reduced naturally. That's why we're here. That's what chiropractic does. In a 2018 study in JMA, it showed that opioids are no more effective than NSAIDs and actually cause more side effects. Now, this is interesting. This is 2018. Do you know when opioids were, do you know what year opioids were approved for general use for pain? Anybody know? What date?
90s?
Yeah, it was 1996.
Okay.
1996. So, you mean they're just doing this study in 2017 or 2018? It should have been done in the 90s. I mean, Tylenol was available in the 90s. Aspirin was available in the 90s.
In 1978, my doctor put me on Valium, said it was non-habit forming. I was on that for 2 years.
What was it?
Valium.
Valium, yeah.
Yeah. And
That's
then
another
it was
form.
2 years later, it came out, and all kinds of news articles that it was addictive, and I had
Bad.
a tough time getting off of it.
Yeah.
I believe you. Well, in the 70s, Valium was the go-to drug.
Yeah.
I mean, if they didn't know what to give you in the 70s, they gave you Valium. I remember that.
Yeah. Reduced.
Adverse
anxiety.
effects of opioid therapies include depression, sexual dysfunction, myocardial infarction, addiction, risk of death due to overdose. A large New Hampshire study, and they looked at insurance claims in New Hampshire, and they wanted to find out what was the effect of chiropractic care on pain. And they found out that 59% of all the patients prescribed for opioids were prescribed for lower back pain. These were not people that were dying of cancer, that, you know, they were in their last stages of cancer and they had so much pain they couldn't control it, which I think would be an appropriate use for opioids, by the way. These are just people with lower back pain. These are people I see in the office, okay? Chiropractic care reduced adverse drug events by 51%, according to that study, okay? Now, how does chiropractic care compare when compared directly with pharmaceuticals? This is a very, very famous study. It's done in 2003. Yeah, go ahead. Just you can go there. So in 2003, there was a study that divided 115 chronic back pain patients up and neck pain into 3 groups. One of them they gave Celebrex or Vioxx. You remember they took Vioxx off the market? Remember that?
Yeah.
Why did they do that? Remember?
Side effects.
Heart attacks.
Yeah.
Producing heart attacks. Took it off the market. They looked at Celebrex or Vioxx, acupuncture, or chiropractic. So they looked at, after 9 weeks, the percentage that were asymptomatic, in other words, no pain. The drugs, 5%, acupuncture, 9.4%, chiropractic, 27% after 9 weeks. Only 8.3 adjustments average, okay? Percentage that suffered adverse effects. Drugs, 6.1%, 0 for chiropractic and acupuncture. Percentage improvement in general health status. How many felt like it improved their overall health? Drugs, 18%, which I think seems a lot. Acupuncture, 15%. Chiropractic, 47% felt like they'd improved after 9 weeks. I think that's pretty good. And that was in the journal Spine, which is the #1 most authoritative orthopedic journal in the world. What about deaths due to medical error? This is an older study. 1993 study from Harvard reported the incidence of iatrogenic deaths. This is physician-induced deaths at 180,000 per year. Okay. In 2004, a report of inpatient deaths associated with the Agency for Healthcare Quality and Research Patient Safety Indicators in the Medicare population estimated that 195,000 deaths caused by medical error a year. Can you imagine? Let's say this error, 195,000 deaths were caused by chiropractors. What do you think would happen to the chiropractic
Put you out of
profession?
business.
Yeah.
We'd be outlawed.
They yank your
Yeah,
license.
yeah. There wouldn't be a profession. Okay.
No.
By the way, do you know how many people die on average a year in chiropractic clinics? Anybody know?
0.
Yes, it's 0 to 1. You know, somewhere around there. Yeah.
Yeah.
Okay.
You shot him in self-defense, right?
Yeah. He didn't pay his bills, so he didn't pay.
Yeah, that's how they die.
That's
That's
how
right.
one died.
That's how they die. That's exactly
Choking
right.
to death, yeah.
Okay.
Died of asphyxiation, yeah.
A 2011 study published in the Journal of Health Affairs showed that adverse events in hospitals may be 10 times greater than previously measured, to over 400,000 a year. But this doesn't mean that 400,000 people are dying, but there's adverse events due to procedures and drugs. 400,000 people suffer problems because of that. Of note, none of these studies captured deaths outside inpatient care, those resulting from errors in care at home or in nursing homes and in outpatient care, such as ambulatory surgery centers. That's in the British Medical Journal 2016. Medical error is the third biggest cause of death in the United States and therefore requires greater attention. Again, British Medical Journal 2016. So let's talk about prostatitis. This doesn't have anything to do with medical error, but I wanted to talk about this tonight. What causes prostate problems in men? Okay, so there's a normal prostate, there's an inflamed prostate. So, is an inflamed prostate a pharmaceutical deficiency? In other words, were you just not born with enough, prostate drug in your body? No. Everybody agree with that?
Yeah.
Okay. So what causes it? Well, one of the big things that causes prostate problems are food intolerances. Because what happens, if you're intolerant to a food you eat, and that inflames your gut, that will a lot of times spill over to your prostate, and it'll inflame your prostate. And if you have prostate problems and you pay attention to what you eat, you're going to find that some things that you eat actually inflame your prostate. So let's look at the big ones. Wheat and gluten, huge one. Alcohol, coffee, dairy is a biggie. Eggs,
Oh, bummer.
nightshade vegetables. Now, corn, this doesn't mean that all of these will do it. For some people it's chocolate. They eat chocolate, it swells it up. So if you have prostate issues, pay attention to what you eat and see if that doesn't affect your prostate. A whole food diet can be very helpful for prostate issues. Now, we have certain supplements that are really good for helping with prostate. But my solution is watch what you eat, pay attention to what you eat, and then when you have prostate issues, make a note of what you ate and see if that isn't a problem. Now, the last thing I want to talk about is what's called a non-therapy of watchful waiting after concussion. Okay, this is in the American Medical Association Pediatrics 2018. So let's look at facts regarding concussion, mild traumatic brain injury. About 3.8 million a year. They're the least understood injuries facing sports medicine and neuroscience. These injuries actually cause concurrent injury to the joints of the neck. So usually when people get a concussion, they injure their neck. It has been known since 2006 that brain-injured athletes are also injuring their cervical spine. So when you injure your cervical spine along with your head, here's what happens. You get headaches, dizziness, loss of balance, nausea. I mean, the whole range of problems from concussion. Other signs and symptoms too. Injury to the brain also causes the following physiological processes. Number one is energy production in the brain goes down. So when you have a concussion, your brain cannot produce energy like it should, okay? Number two, reduction in blood flow to the brain, secondary to autonomic nervous system dysfunction. So when you injure the brain and the neck, your brain cannot produce energy and the blood flow goes down. Do you think that's a good thing?
No.
Not a good thing at all, okay? Now, here's some therapies to speed up healing process of concussion. Just humble, good old coconut oil will help, okay, which I put in my coffee every day. Alpha-lipoic acid, N-acetylcysteine, whey protein, acetyl-L-carnitine. These are supplements that we have in the office and formulas. Magnesium and omega-3 fatty acids. Why would coconut oil and omega-3 fatty acids be important in healing the brain? Who knows?
Because your brain is mostly fat.
Good answer, Terry. Great answer. That's exactly
I was
the
gonna
right
say,
answer.
I've been here before, yeah.
Yeah, yeah, you've heard me say that.
I've heard that
Your
once or
brain is
twice.
mainly fat,
Once or
okay?
2 million times,
If your
yeah.
brain is mainly fat, you got to feed it good fat,
Yeah,
okay?
yeah.
That's why low-fat diets are bad. They're hard on the brain,
Yeah.
okay? So these are the now. Well, I did this presentation once. Oh God, a year and a half ago. I had a female patient of mine, 26 years old, and I mean just an avid soccer player. So I see her like once a month. So one Friday she calls in, and I'd just seen her like, the week before. And I'm not expecting to see her for a month, and she comes in and she got hit really hard in the head with a soccer ball and started getting, the symptoms of concussion,
Yeah.
dizziness and all of that.
hurts.
She said, I saw your presentation, so I thought I'd come here before I went to see my MD. So what did I do with her? Fixed her neck, lasered her, did some neurological testing on her before and after. She was fine afterwards. Okay, she had a full recovery after that. What about the efficacy of chemotherapeutic drugs? Here's something very interesting. In October 2017, the British Medical Journal stated there were 50% of cancer drugs approved between 2009 and 2013 were completely worthless, despite the fact they continue to be used. That was October 2017, British Medical Journal. This is a free article, by the way. You can look it up online and read it yourself. In February of 2019, JMA article said the following about cancer drugs. Chemotherapy, given in the 90s, was ineffective and toxic. Okay, I knew a lot of people doing chemotherapy in the 90s. I was practicing back then. And that was considered like the state of the art back then.
Yeah.
They said today's chemotherapy drugs have the following side effects. That was in this article. Dementia, osteoporosis, autoimmune disorders. Who would want to take, I wouldn't want to take chemotherapy drugs if it was going to do that to me. There are many more examples I could give, but I recommend the book Undoctored by William Davis. He's a cardiologist, wrote a great book, which I've read. This is that if you really want to get into how medicine, much medicine hurts people, read that. So here's the thing. I want to help people naturally, and I want to get rid of their pain as naturally and their symptom as naturally as I can without all the problems that pharmaceuticals and medical procedures do. On October 29th, we're doing a patient appreciation day where we're going to do free spinal exams that day for anybody that wants to just get checked. Who do you know that needs to come in that day and get checked? We won't force them to be a patient. We just want to see, can we give them some information that might be useful to them in getting better? It's the 29th of October. Yeah, we'll see you. Thanks for being here tonight.
Hey, thank you.
You bet. So, if some of you know some people, Carmen will sign them up. We got three spots left for that day. 3 spots left. Be happy to check them, give them 15 minutes of our time, and say, okay, this is what we're finding. This is how it relates to your symptoms. What do you want to do? That's all we're gonna do that day. So, what do you plan to do? Do you plan to be more proactive or reactive? What is your basic model of healthcare? Is it a drug-based model, a procedure-based model, or a health-based model? Do you blindly choose to trust invasive and possibly dangerous medical therapies? These are questions you have to ask yourself, okay? So that is all I have tonight. I've gone 4 minutes over, which I don't like to do. Does anybody have any questions before we end?
I have one on with your studies that was shown, it said the elderly had 16.9% more
Adverse drug reaction.
Yeah, that's it.
Yeah.
Why?
Well,
Is it because you're older and is it because your immunity system is less?
it's because you cannot process drugs very well when you get
You
older.
get
Your liver
allergic.
doesn't work as well.
Okay. When
I
you get
got,
old-
sorry. I might